Dr. Anders Tegnell, hello. You are Sweden's chief epidemiologist. You are the architect of Sweden's very own, very specific approach to the COVID-19 crisis. The first question I'd like to ask you is, how is this strategy going at the moment?
I think at the moment we are very happy with the strategy. The number of cases has fallen in Sweden during the last couple of months. We're now down to very low levels. Lower levels than most countries in Europe actually right now. Our mortality has gone down to almost zero. We have very few cases in intensive care and almost no cases in our hospitals anymore. So right now we're quite happy and we are heading into the fall with some confidence.
So you say you're heading into the fall with some confidence. It's true that the figures of new cases per day are extremely low in the country, around a 20th of what we have in France, for example, or other European countries. Do you think that is something that is going to be sustained, that it is going to carry on like that?
I think we're reasonably confident that it can be sustained because we are building this on the same kind of strategy that we'll be using all through this pandemic, trying to get people to stay at home when they're sick, working from home as much as possible, keeping distance in the society. And that staying with the same strategy means that we can keep on having this strategy also through the fall. And since that strategy has served us reasonably well so far, we also think that it can serve us well during this fall.
The figures are around, what, 100, 120 new cases per day on average. We'd say it gets as low as 60 some days, as high as 180 some days. Do you think you're going to see the same figures, or do you think there might be a spike? Because we are seeing a spike in the southern Europe.
Yeah, I think what we are calculating is going to happen this fall is that we're going to have local outbreaks, like they've seen in Norway, like they've seen in Germany, in specific locations, special working places or something like that. That's what we are most concerned about, and that's what we are really building much of our preparedness to find those and to deal with those as quickly as possible.
Now, as you know, of course, the strategy here that you have implemented is very criticized because it is different from what's been done in other countries. You've not enforced a lockdown. You're not forcing people to wear masks on the streets, for example, as it is the case in other countries now and the rest of Europe. First of all, why did you choose this strategy? Can you explain it? Why not, choose to lock down or to wear the face masks?
Because this is very much in the strategy and in the tradition of the public health work, and that's why we started with this kind of voluntary strategy, giving a lot of influence to the population, giving them a lot of responsibility, the same way we do in many other areas, and which we know works quite well because there's a high level of confidence between the population and the agency. And since we started with that, we managed to keep the number of cases reasonably low all through. We managed to keep our healthcare system running with a high level of quality of care, and there was always free beds for any COVID-19 case in the hospitals. We never were really pressured to do a drastic thing like closing down society, especially since we know that closing down society will have a lot of negative effects on public health in many other areas, except for the COVID-19.
But this strategy has had a cost in human lives. I'm thinking of all the Swedes. I mean, you have pretty much, on average, around 10 times the mortality rates that your neighboring countries have had, Norway or Finland. And is this not due to this strategy?
No, there's not complete a connection to that, because you can look at countries like Belgium, Netherlands and France who have similar mortality rates compared to Sweden. Sweden had a very heavy epidemic very early on, much heavier than many of our neighboring countries, with a very heavy startup. So that, I think, influenced the spread in Sweden very much and made our pandemic look much more like the pandemic in the UK or in France and many other countries, and not comparable to Norway and Finland. Furthermore, we can tell that with the same strategy now, since the last 2 or 3 months, we see almost no cases in our elderly homes, and our mortality rate has been very low for several months already. So there is definitely not a close connection between the strategy and the mortality rate. This was very much due to a high level of mortality in our elderly homes, long-term care facilities, which had weaknesses, not everywhere, but in a number of places that made it possible for the disease to spread very much in those places. And we know from every country that if you get a high level of incidence of disease in those places, you get a high mortality because the people living there are the most likely to die from this disease.
But you did say, so for you there is no correlation between these high figures and the
I don't say there is no correlation at all, but I don't say that there is a clear correlation, because we have been able to run this strategy with a very low level of mortality and very low level of incidence in these long-term care facilities. So this was a weakness in the system of elderly care that was known to a certain extent, but the exact extent of it and how important it was not to have those kind of weaknesses during a COVID-19 outbreak was not known before. But we also know that in many other countries, UK, which I had several discussions with, have a similar experience, that long-term care facilities are very vulnerable to this disease, and the level of mortality and level of disease spread in those healthcare facilities
So you
will be very
say
great.
nothing has gone wrong. I mean, there are 5,800...
Yeah, of course something went wrong when 5,800 people died. That's definitely not something we expected, nothing we planned for, nothing we hoped for. So that's definitely gone wrong. But that does not mean that the strategy in itself has gone wrong.
As far as this strategy, it is different from the rest of the world. For example, face masks. For you, face masks don't need to be made mandatory in Sweden.
No, first of all, we don't use mandatory for many things in public health in Sweden, and still we have a very good...
But you don't even recommend them. You don't even recommend wearing face masks.
Right now, when we have the level of spread that we have in Sweden, with the spread even slowing down slightly, we don't see a reason to introduce more measures, especially not measures where the quality of evidence is very low. I mean, any kind of review you read about face masks, everybody agrees that the evidence is very weak for the effect, and if there is effect, it's probably not very big. But I can understand that in some countries where you have an increasing spread, you have a widespread in the population, you need to take on even measures that are not the best ones. We can stick with the best measures so far, and the best measures is to have a social distancing, stay at home when you're sick, and trying to work from home. Those measures are definitely a lot more effective than face masks, and as long as you can use those and get a good control of the disease, I mean, WHO and most other agencies would say that's a good choice to do.
But the choices you've made have been criticised by doctors all over the world, and including here in Sweden. When you took these decisions, what was the goal when you said, right, I don't know, the rest of Europe is locking down, we're not locking down. Now the rest of Europe is saying we're going to wear face masks, and you say there's no need for it.
No, I mean, every country has to follow the disease spread in the country, deal with that according to the circumstances we live in. I mean, we have a possibility here in Sweden to do this without severe lockdowns. We still slow down the Swedish society just as much as in many other countries. We can see that Sweden travel a lot less than they usually do. They actually decrease their travel more than the travel was decreased in our Scandinavian neighbors. If you ask Swedes, 80-90% of them say that their lives have been very much affected by the COVID-19. So I think you make a mistake if you think that the Swedish lockdown was less in place and was less effective than in many other places just because it was a voluntary lockdown. But in many ways, this voluntary lockdown was just as effective and had just as much also negative effects for the population as the legal lockdowns that we have in many other countries.
Right now, the figures are very low as far as new cases are concerned. Do you believe that is because of immunity that has been acquired over this crisis? I
mean, I think, like many things, this is a complex thing. Part of the reason is definitely that the Swedish population has been very much in favor of what we are doing. We have a high trust from the population. They actually follow our advice to a very high level. Like 80-90% of the population say that they follow the advice we've been giving, at least as much now as they did several weeks back. So that's one very important part, and that, of course, in the long run will give an effect. That effect is, of course, amplified, but that the level of immunity in the population is slowly increasing, and we can see that in our measures. So it's a combination of the two.
Was it a goal, herd immunity?
Definitely not. I mean, trying to get infected on purpose, people getting infected on purpose is of course not accordance to any kind of public health policy. We try to slow down the spread of the virus as much as anybody else in any other country. And we managed to slow it down just as much as most other countries. It took slightly longer than a few other countries. On the other hand, we don't have the resurgence of the disease that those countries have. So in the end, we will see how much difference it will make to have a more a strategy that's more sustainable and that you can keep in place for a long time instead of have a strategy that means that you lock down, open and lock down over and over again.
But now I'm speaking to you and I get the impression that in a sense you're telling me that at the end of the day it was not made mandatory, but you're saying that the strategy here, apart from the face masks, is pretty much the same as everywhere else. Is that?
To a great extent, yes. I mean, we also slow down many things. Domestic air flights in Sweden were slowed down to basically nothing. There was no domestic flights in Sweden anymore. This was due to people stopped traveling, not because we made it mandatory for the flights to stop. Trains were also cut down quite a lot. So the society really slowed down quite a lot also in Sweden. I think much more than many people in other countries understand.
So would you say, because the world is saying there's a Swedish model, you don't think there is one, in fact?
There is always a Swedish model as well as there is a French model, a Dutch model, or a British model. We all fashion our response to this kind of health crisis according to the context we live in, the legal basis we have to do things and so on.
Do you think Sweden has got over the hump? Do you think it's over here?
No, it's not over for anybody. This is a disease that's going to be with us for a long time, and we're going to have to adapt to it in different ways over this time.
Well, Dr. Anders Tegnell, thank you very much for giving us this interview. Thank you for watching this show, and please stay tuned to France24 for more news.